to the Wild Wisdom Podcast with Dr. Patricia Mills. I'm Dr. Patricia. This podcast is for people who want to transform their health, restore their hormones, and reconnect to their body's natural wisdom. Hi, I'm Dr. Patricia. I'm a Canadian medical doctor, published author, internationally recognized researcher, and passionate advocate for your health. Here, we'll explore the intersection between ancient wisdom and cutting-edge science, distilling the essence of true health into practical steps you can take. Wild wisdom is instinctive knowledge in action. Thanks for making this part of your day. Hi, it's so lovely to be here with you today again, and thanks for tuning in. And what I wanted to dive into today was the topic of PCOS, or polycystic ovary syndrome. Okay. Now, if you're someone who has PCOS or knows someone with PCOS, a lot of this, at least the very beginning part, will resonate with you, for you. And if you're someone who has never been given that diagnosis, however, you have problems with either hormonal imbalance, menstrual irregularities, problems with natural fertility, adult acne, maybe you have some problems with abnormal hair growth and certain, more of like a male pattern of hair growth, up on the upper part of the lip, for example, or being overweight, with a combination of these kind of symptoms, then you would benefit from listening to this podcast, because what polycystic ovarian syndrome is a syndrome. It's not a diagnosis, actually, okay? And the medical community, when they have a group of people, and in this case, women with ovaries, presenting with a certain constellation of signs and symptoms, so things that you see and things that you feel, that things that you observe happening and things that you feel happening, and you start to see these like common patterns, and it's not, and not everybody has all of it. So even women who, you would think that in order to have polycystic ovarian syndrome, you would need to have detectable ovarian cysts on the ultrasound. However, what I think is interesting is that there are some women who have all of the other constellation of problems, such as, and what do people with polycystic ovarian syndrome tend to present with? Okay, what is that constellation of symptoms? So, as I mentioned before, signs of hormonal imbalance with irregular menstrual cycles. So either not happening at the right time, not happening frequently enough, or happening too frequently, or heavy bleeding or spotting. Okay. The other thing is that when you do try to get pregnant, you have problems with natural fertility. So a very hard time getting pregnant. Okay. And that may or may not be associated with the difficulty in ovulating, the act of ovulation, which is necessary to release the egg from the ovary. You may or may not have problems with acne. You may or may not have problems with facial hair growth, right? You may have problems with your mood, like feeling irritable or depressed or anxious. You may be overweight, and you may not. Actually, I know a lot of women with PCOS who are not overweight, although that is the predisposition, is to be overweight, okay? And then the problem is that because the underlying problem is a hormonal imbalance, when you go into menopause, the transition into menopause can be really difficult. And your menopausal experience can be really difficult, okay? And so the traditional way of dealing with this, the current medical paradigm of dealing with this, is that you go to your doctor and you present with these some of these, very rarely all of them, although some people have all of these symptoms, signs and symptoms, but you might have a few of them. And then they might order an ultrasound of your ovaries if they kind of get clued into this is sounding like PCOS, and you might have cysts on your ovaries, which are fluid-filled sacs on your ovaries. And then they're like, okay, well, you have a diagnosis of PCOS, and it's a syndrome because we don't actually know what caused it. Okay, we don't know the cause of it. We don't know what's causing this hormonal imbalance. Okay. And so it's really tough for women who are suffering with PCOS, because what happens is that the typical treatment is to give a hormonal contraceptive, like the oral contraceptive pill, for example, or putting in an IUD, a hormonal IUD like the Mirena. And the attempt is to actually make the person feel better and maybe even improve a few of the issues, like maybe your acne will get a little bit better. In some cases, you can have improved fertility, okay? Like your chances of getting pregnant are higher on these treatments. However, what actually caused the hormonal imbalance, or in other words, the root cause, has not yet been fixed, right? Because the root cause was not a deficiency in an oral contraceptive hormone, right? It's something else. And the drug is the Band-Aid, but not the solution. And why does this matter? Because research shows that when you don't treat the root cause and you just use the Band-Aid solution, and in the case of PCOS, this has shown itself to be true, is, for example, let's say your problem is your main issue with PCOS is that you have problems with fertility, okay? So you go to the doctor and you undergo fertility treatments and you get pregnant. Well, because the underlying issue has not been improved, you continue to have problems with hormonal imbalance in your pregnancy. So women with PCOS tend to have more problems with developing gestational diabetes, which is a hormonal imbalance during their pregnancy. They're more likely to suffer from a miscarriage. They're more likely to have their babies born too early and at a small weight or like a too large weight. Okay, so they're more likely to experience complications during pregnancy and during delivery. All right, and then if you take that person with PCOS, and let's say that person with PCOS is being treated with hormone therapy as like the Band-Aid solution, that even with the hormone therapy, that woman is at a higher risk for down the road developing hormone imbalance conditions like type 2 diabetes, developing Alzheimer's, which some types of Alzheimer's are related to problems with the hormonal system, and having problems with stroke and heart attacks. What that tells us is that if all you do is use a medication to make you feel better and have a few things improve, but you don't treat the root cause, that root cause is still there and it's still causing problems with the way that your system is working, so that you will continue to develop additional problems in the future. It's like you haven't gotten off the road of the PCOS kind of destiny, so to speak. Like you've made the road less bumpy, but you're still on that road of like whatever caused the original issue to continue so that you develop the subsequent issues as well. Okay. So I will never present you with a problem without giving you the solution. And what I wanted to do just with this piece was to first set the stage on why it's so important to understand that there is a root cause for PCOS, and that it's very important that you address the root cause so that you don't experience future problems, like additional problems in the future coming into your life. Thank you for taking the time to listen to this podcast, Wild Wisdom with Dr. Patricia Mills. If you like this podcast, please take the time to like and subscribe, and please feel free to leave any comments and look below for the contact information if you want to connect with me directly. Thank you, and I hope you have a wonderful day, evening, or night.
Hi everyone, I hope you enjoyed this episode. Just a reminder, this podcast is for educational purposes only. This podcast is not a substitute for a professional care doctor or other qualified medical professional. This podcast is provided with the understanding that it does not constitute medical or other professional advice or services. If you are looking for help in your journey, it is important that you seek out a qualified health practitioner. If you would like to work with Dr. Patricia for her expert health transformation guidance, please email her at info@drpatriciamills.com to book a discovery call. You can also find Dr. Patricia on Instagram at Dr. Patricia Mills and Facebook at Wild Wisdom for Women with Dr. Patricia Mills, MD. For access to all of Dr. Patricia's educational videos and more amazing perks, consider becoming a Patreon member. Links are in the description of this episode. It is important to have an expert in your corner that can help you make the changes you crave, especially when it comes to your health.